contraction, lifting the rectum, right? So I say butthole to belly button as the.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronski, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. So, Dr. Mills, what are your top favorite tips for treating urinary incontinence after prostate cancer?
Yeah, so I always start after we've discussed habits. Habits is always an important one. Specifically, getting a more operative bladder. So I'm always encouraging working up to assessing where you're at with your current water intake, and then working up to half your body weight in ounces of water a day. That butted up against being able to have the ability to be on a bladder schedule from every 2 to 4 hours, I would say is like the number one habit forming process. And having those two numbers and then being able to use that as a guide for everything else is also super important. So that's what I would say the number one is. The number two is on the front end, coordinating pelvic floor contractions. I don't have my pelvis with me at my home office, but I've been saving this for another video, but it'll make a special appearance. So I'm a huge Star Wars nerd. This is a tauntaun. Okay. I want to get like an action figure of Luke Skywalker to like sit on the tauntaun and then have some reins, because when we're thinking about a pelvic floor contraction, it is most ideal to have a front to back contraction. So I think that the cue of like turtle head in the shell or like elephant trunk lift is a little boring. So I like to think of like pull back the reins on the tauntaun.
Very creative.
So there's a pulling in and then a lift back, and it's kind of like, you're riding the tauntaun. After that, after the pullback on the tauntaun, I like to say nuts to guts, lifting the testicles upward. And then I also like to say that as the third part of the contraction, lifting the rectum, right? So I say butthole to belly button as the third part of that contraction. Most guys struggle with the front side at the beginning, right? Most guys are very I would say rectally inclined, where there's not a whole lot of activity happening on the front once you do the assessment. So a front to back contraction is most ideal. And then the third part I would say is applying that to everyday life, being able to do that coordinated contraction while not increasing your intra-abdominal pressure. And on the front end, that typically looks like pairing things with an exhalation. On the back end of the rehab process, we're teaching people how to breathe and brace and lift weights in the same way and coordinating a pelvic floor contraction with that. But on the front end, it's easiest to get the hang of it if you're exhaling before you go to do something. So those would be my top three.
Awesome. Thank you, Dr. Mills.
Yeah.
Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, Be sure to type it in the comment box below.